Hello, my name is Jill Berry Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, guess what? Guess who's back? I'm joined by Tyson Moulton, NMC's Director of Facilities, and Amy's returning, Amy Putnam, who is our Vice President of Physician Services. And we have some exciting news to share, a date that's happening November 20th, and that's when our medical office building, that big building on the campus that we've all been waiting for, will be opened for patients. So welcome back, both of you.
Thanks for having me.
Thank you, Jill.
So let's start off by just grounding the viewers a little bit about who each of you are, and then we'll jump in to the big news.
So I'm Tyson Moulton. I'm the Director of Facilities at Northwestern Medical Center. I've been here for about 3.5 years and had the pleasure of seeing this major project through. It's been a wonderful journey, and it's great to see it all coming together. We have an end date on the horizon now, so it's been a great journey.
Yeah, thank you.
Good morning, Jill. I'm Amy Putnam, and I'm the Vice President of Physician Services at Northwestern Medical Center. I have been with the hospital for just under 2 years now, and the scope of my role is to oversee all of the outpatient practices for the organization. And as Tyson had mentioned, this MOB, the medical office building, is just an incredible opportunity for so many of our physician practices and a real gem for our community as well. So looking forward to it opening.
Great. Well, it's great to have both of you here, and let's talk about November 20th. So what are we going to see on November 20th?
November 20th will be the opening of 3 pretty large service lines in physician practices, as well as our outpatient labs. So the first one is our Northwestern Orthopedics, currently located at Doctor's Office Commons 3 and 4. It will then move to the medical office building. The second service line is our Northwestern Primary Care, and that will be located in the medical office building as well. The third service line will be our Northwestern Urgent Care. So those are the 3 physician practices. And in addition to the physician practices, we will also have our outpatient lab. So those individuals looking to have their blood drawn will come to the medical office building for that, beginning November 20th.
Perfect. Now, November 20th, that's a little bit later than we had planned for the medical office building. So maybe tell our viewers a little bit about that change.
So as we worked through this project, there were some decisions that were made early on about how traffic was going to flow in front of the medical office building. It's kind of a tight site. We're hemmed in by Fairfield Street, and then the loading dock behind it, and the boiler room, and some services that really can't move. So we had this narrow spot to put the building, and we had a certain depth that the building needed to be able to get everything into it. And then all of that kind of extrapolates out into your travel lanes and your parking areas and things like that.
Right.
So as we looked at that early on in the project, there was a decision that was made to make the traffic one way. So you'd come in off of Crest Road, and it would be a one-way turn into the medical office building, and then there would be a drop-off and parking, and all of that generally stayed the same. As the project evolved, we added additional handicap parking in that area, and as we were able to start to see what it would look like in person, we kind of called a timeout and said, is this really what's best? Is this what's best for access for the community? And is it really going to provide the best access to these important services, especially with urgent care, how people may be coming to campus for the first time. They don't necessarily know where they're going. They don't have the benefit of a contact prior to an appointment where they can describe kind of how to get there. And so we made the decision at that point that road really needs to be two-way so that you can get to the handicap parking and to medical office building from our main entrance and from our Crest Road entrance.
Okay.
And so what that means is that we had to expand the travel lane in front of the medical office building, and that meant the addition of a retaining wall because we do have an elevation change there. And so that's been the holdup. The decision to make a long-term decision about how access to MOB is going to function, even though it delayed the project, a couple months. We believe it's the right thing to do for the access to the services. So that's the reason that we went to a little bit later date.
Okay. Well, that certainly makes sense. I mean, the project is all about access and ease of
Absolutely.
access, so that for parking and for drop-off. So that sounds like a great move, and I know our board was involved in making that decision. And I guess you can think about it either way, but this allows for the most flexibility. So
absolutely, and with large projects like this, there's bound to be some rethinking as we go through it.
Sure.
And it's I forgot who it was who said it, but this is something that's going to be in place for a long time.
Yeah.
So if we have an opportunity to make it right now, then we should do that.
yeah, exactly. Thank you. Okay, so we can get everybody to the front and get them parked. And so we got this November 20th date. So what about the logistics? I mean, we've got urgent care happening and orthopedics happening, and is there going to be any interruption or disruption for the community in accessing services today on one day and then tomorrow in the new medical office building? So what's that transition going to look like?
Yes, we have teams of individuals that are working on
bet.
this. Tyson's teams as well as the clinical folks as well. And this isn't the first time we've done this. As you remember, in April we did it with the medical clinic.
Yeah.
So we've become a bit of an expert in being able to move these practices and making it fairly seamless for our patients so that they don't feel a lot of that disruption. It will be very brief. We're going to most likely use the 17th, which is a Friday, and that Saturday and Sunday, to make sure that all the critical pieces are in the final move and open and ready for patients on Monday, November 20th. So we don't anticipate too many disruptions in that at all. Yeah, and clinical staff and physicians, all of our providers and staff will be waiting to greet patients and help them to navigate our new building.
That's great. That's great. So in thinking about the services, it's always kind of thinking about the why, why we're doing this. So what do you see as the enhancement? What improvements do you see for our community?
Yeah. Integration, I'll answer from a clinical perspective, is the integration of the services. To have our medical clinics and our primary care and orthopedics and urgent care all be within the same building, and for patients to be able to navigate the services they need. It's really about the right care at the right time and making it easy for patients to get the service they need and get back home as quickly as possible. The design of the building, which the community will see as they maybe attend our open house, is that it's a real fluid design. So patients as well as the providers can easily access the services within the building and be able to work more independently as well as a team so that they have the right access to the different disciplines, which is going to be very, very exciting. We know with our medical clinics, we have experienced that now with cardiology and pulmonology and OBGYN, and it's just wonderful feedback from providers and patients just about the ease of the building.
Excellent. Now, it has its own front door. We've talked about getting there, so front door separate for that.
Yeah.
And so what does the registration, so when you walk in, what should patients expect for registering and getting into the system?
Yes, it will feel a little bit different than what they see now, because we're built in silos, in separate independent practices.
Yes.
So as you enter the medical office building, you'll be greeted by patient access who are ready and have practiced and are excited to be able to use this new building. So you will register right in the vestibule, right in the main lobby, and then you'll be directed to the service line that you're there to see that morning. So at primary care, orthopedics, or urgent care, or the outpatient lab as well.
Terrific.
And then from there, your clinical staff will pick you up and be ready to provide you that service.
That's terrific. So talk about the, how is it connected to the rest of the hospital spaces?
Yeah, so the medical office building is its own freestanding building, but we have a connector corridor that connects right into the medical clinics building. That was that new addition in the front that opened in May. And from there, it leads right into our main lobby. So all of these areas, all of the things that we've built over the past year or so, are all connected.
So maybe this is a good time to remind our viewers of the rest of the project, because even with November 20th, that we want people to be well aware of, what about that other piece, the inpatient piece? So maybe
Sure.
connect us on the totality of the project, and when is the real end date of the entire project?
Absolutely. So this is obviously one aspect of what we call the master facility project, which has three aspects to it. One is inpatient addition and renovation. The second is the lobby renovation and medical clinics building. And then the third is the medical office building. So the lobby renovation was completed and opened at the end of last year. The medical clinics building was completed and opened, I believe it was May 1st of this year.
Okay.
The inpatient addition and renovation, our new progressive care unit, was opened in April of this year. That was the addition, and we are currently involved in the renovation of the existing space, and that will be coming online in mid-January. Now, that is the kind of the close of the major construction for the projects. But there are still some odds and ends that we have to do. There's some areas that still need a little bit of renovation. We're doing some kind of facelift work in the hallways and areas right around where the progressive care unit intersects with the rest of the hospital.
Okay.
And that'll continue into February. And then in the spring, there's going to be some site work
Sure.
that still needs to be done. There'll be some plantings. We have a healing garden that we're currently in design on. That will be connected to the progressive care unit so that it can be accessed by patients and visitors and have a nice calming outdoor space. So that'll be ongoing in the spring. But the bulk of the project will be completed and ready to be used in the middle of January 2018.
Woohoo!
Finally, it's exciting.
What are you going to do with all your spare time?
I'm sure you'll fill it up somehow.
No, I don't know if that's fair to tell our viewers. We're always progressing and trying to improve the care.
Absolutely.
Yes, yeah, there's always stuff on the horizon.
That's terrific. So, Amy, on the medical clinics, I know our time is getting short here, but I know we have cardiology and pulmonology. Are you anticipating other things to come?
Absolutely. We have 2 new clinics that we are excited to offer to the community, hopefully by the end of the year. That's the start date that we are targeting at this point. It will be neurology as well as endocrinology. So neurology will likely be available a couple of days a week, and endocrinology will likely be available a couple of days a month to start, but we anticipate growing both of those service lines as we progress into the new year.
That's great, and that's with our partnership with
UVM. Absolutely.
Medical Center, so using their expertise by providing medical expertise here, so folks don't have to travel. So that was one of the benefits of this project, is having that space for rotating clinics. So I appreciate certainly your leadership and making sure we have the right services at the right time, and Tyson, clearly your leadership in what's the right infrastructure, what's the right environment, and that integration that you talked about at the beginning, so that it's that easy access and flow of services depending what the patient presents for. You know, that whole vision about if they come through the door for urgent care, but maybe they have an orthopedic need, and we have, you know, a PA or an orthopedic surgeon, you know, that's available. I mean, that integration, or they need to see primary care. The integration is beautiful, and the medical clinics right next to it. It's I love that flow, and having that outpatient services, you know, really, you know, at the front, making it easy and accessible, and certainly thank you for stopping and reflecting with the team to rethink how we access the campus. It all kind of fits together into a story that we really want to be the hub of health, you know, for our community, no matter what their needs are, how we can connect them with our services, but also the services of the community. We have so many wonderful community partners. So it's a great story, and thank you for your leadership and being a part of it.
Great. Well, thank you for having us.
Yes. Is there anything else, any last words that we want to make sure the community knows before the November 20th? You know, that's the date that we open up the space for services. So is there anything that we should point out?
I would say that the teams are very excited. It's a new space, and they're ready to work in a very integrated fashion and be able to provide services differently than we have in the past. And it's the progression that you spoke to. So we would love the community to know how excited we are, and looking forward to seeing them November 20th.
Great.
Yes.
Yeah. November 20th, we're really excited about the building. I'm really happy with the way that it turned out. The whole team is really proud of what we've been able to build, and ultimately how we're going to provide care to the community. So we're looking forward to November 20th for everyone to come in and experience it with us.
That's terrific. Thank you. And thanks for mentioning the staff and the providers, because this is about one team working together in an integrated way that connects the dots for the patient for easy navigation in their healthcare journey. So beautiful. And now we have the facility to do it in. Fantastic staff. Now we have fantastic facilities. So the community deserves that. Yeah. Thank you. Thanks for joining us. You know, we think about the reflection of the past year and a half or more, and being on this journey from making a decision to going live with this beautiful project to serve our community better. And I just want to pause and certainly thank Peerless Clothing for investing in us to be a lead donor in this project. We've had so many wonderful donations from our community, and we're grateful for the entire community support. So please join us on November 20th and experience this enhanced service. Thank you for joining us today.